So hello everyone, our today's topic is a viral infection. So here we shall be discussing about the first, that is the herpes virus. So the herpes virus, as we know all, that it is an enveloped virus of size 100 nanometer in diameter. So the herpes virus, they are family of double-stranded DNA viruses. Remember for your exam, the herpes virus, they are the family of double-stranded DNA virus. Now what are the various types of herpes virus? They can be herpes simplex virus type 1, type 2, type 3. Type 3 is also known as varicella zoster virus, and type 5, that is known as cytomegalovirus. More recently, herpes virus types 6, 7 and 8 have been discovered. The type, remember the type 8 is known as Kaposi sarcoma. Human herpes virus type 1 is primarily the mode of transmission has a mode of transmission primarily through the direct contact with the infected oral secretions or lesions. It can be spread through kissing, sharing utensils, or coming into contact with the saliva. Human herpes virus type 2, the mode of transmission here, it is through the sexual contact, through the genital area. It can be also transmitted from mother to newborn during the childbirth. The human herpes virus type 3, that is also known as varicella zoster virus. It spreads through the respiratory droplets. From infected individual through coughing, sneezing. It can also contact through the with the direct contact with the fluid from the chickenpox lesion. Type 4 is known as Epstein-Barr virus. The mode of transmission is mainly through the direct contact with the infected saliva or through kissing. Human herpes virus type 5 is the cytomegalovirus. The mode of transmission here is through close personal contact with infected bodily fluids through urine, saliva, and the blood. Type 6 and type 7, they are transmitted through saliva or respiratory droplets. The type 8, that is also known as Kaposi sarcoma, it is transmitted through the sexual contact in the immunocompetent individuals. The human simplex virus type 1. The herpes simplex virus, also known as HSV, is an infection that is caused by herpes. The HSV type 1 primarily causes oral herpes. and it is responsible for the cold sores and fever blisters. Whereas type 2, it causes genital herpes and it is responsible for genital herpes outbreaks. So what is the most common site for the latency of herpes simplex virus? It is the trigeminal ganglion. So the virus will travel along the sensory neurons axons between the skin, mucosa and ganglion. Suppose a person is initially exposed to HSV1 infection. The virus will enter the body through break in the skin or mucosa, usually in or around the mouth area. So what will do, it will start replicate in the cells at the site of entry, causing the characteristic cold sore lesions. So once the virus replicate at the site of entry, it has ability to invade nearby sensory nerves. So these nerves carry signal from the skin to the central nervous system. So the HSV1 virus, it travels along the long projection of the nerves cells called the axons. So these axons can be thought of a wires that are connected to different parts of the nervous system. So the virus, it is transported in a backward direction, moving from skin toward the nerve cells, which is located in the ganglion. So once the virus reaches the nerve cells in body in the ganglion, it enters a latent state. So what does that mean? The latent infection, that means the virus becomes inactive and it does not cause any symptoms. It hides out in the nerve cells. So periodically you will see the virus, it will reactivate from its latent state. So what are the factors that cause it to get reactivate? Various factors like stress, illness or weakened immune system, they will trigger this reaction or reactivation. So the virus will become active again, travel back along the axon to the skin or mucosa and cause new symptoms like cold sore. So the recurrent HSV1 infection, it happens when the virus, it becomes active again. That can be triggered by things like getting older, sunlight, stress, being tired, extreme temperature, pregnancy, allergies, dental work, sickness, fever. So these are the reason for the virus to get triggered. So when the virus will become active again, it can cause symptoms or not show any signs. More often the virus become active without causing any symptoms. So this is known as asymptomatic viral shedding. The crowded living conditions, poor oral hygiene, they increases the chances of getting exposed to type 1 viral infection. The acute herpetic gingival stomatitis, it is the most common form of primary herpes simplex virus that is caused by herpes simplex virus type 1. So remember, it occurs in children age 6 months to 5 years. That is very important for your exam point of view. It occurs in children age 6 months to 5 years peaking at second to third year of age. So what is the symptoms? The infection usually starts with the symptoms like fever, chills, sore mouth, and swollen lymph nodes. There is vesicular and ulcerative lesions, gingival, stomatitis, and malaise. So these are the most important features. The mouth lesions, you will see small vesicles form initially. They collapse into red lesions that become bigger and develop a central ulcer covered by yellow fibrin. The gums are painful, swollen, and very red. So the rare complication may be seen including the eye infection, esophagus inflammation, lung inflammation along with that. Primary infection in adults commonly causes pharyngitis and tonsillitis. So vesicles form on the tonsils and back of the throat that can turn into ulcers with grey-yellow covering. Other features are keratoconjunctivitis. Infection in the eye produces severe conjunctivitis, encephalitis. The recurrent herpes infection can occur when the virus it enters into nearby area supplied by the same nerve ganglion. It often reoccurs at the vermilion border of lip, termed as herpes labialis or cold sore. Some lesions may be seen on the fingers, that is known as herpetic white flow, and the bodies of wrestler. The term we use here is herpes cladioratum. The herpes infection on the fingers, it can occur due to the self-inoculation from oral herpes simplex 1 in children. Eczema herpeticum, it is a primary infection in the HSV1 in person with the chronic eczema. People with the skin condition like eczema, pemphigus and diarrhea disease may experience life-threatening herpes simplex virus infection that are known as eczema herpeticum. Newborn can also get infected during the birth, usually with the herpes simplex virus 2 from the contaminated birth canal, as the route could be genital or the sexual route. Coming to the clinical diagnosis, clinician can often diagnose the herpes simplex virus based upon the symptoms and appearance. The lab confirmation might be necessary due to the confusion with the other diseases. Second, one can do is viral isolation. So you can do is growing the virus in tissue culture from the fluid of the intact vesicle. But since the intact vesicles, they are rare in mouth, and rupture lesions are unreliable as they are the source of contamination. Third, cytological smear and tissue biopsy are common method. Additional tests like direct immunofluorescence, immunohistochemistry, PCR, they provide a more definitive detection of herpes simplex virus. The biopsy of the persistent ulcers in the immunocompromised patient should also be tested for the cytomegalovirus infection, as their histopath features can easily be missed. Serology also helps to confirm the recent or past herpes simplex exposure. Now, what is the treatment? The treatment for the herpes antiviral drugs are given. Pain relief can be given like medicaments like dicyclonine, hydrochloride spray, tetracycline, or NSAIDs can provide the pain relief. The patient should avoid contact with the active lesion to prevent it spreading. The recurrent herpes labialis various treatment includes that are topical ointments like acyclovir, systemic medicaments like acyclovir, valacyclovir, famciclovir, they are effective. Newborns and person with eczema should be protected from exposure to person with active herpetic lesions. So remember, the acyclovir is the current standard treatment. The next is the herpes zoster virus. So the herpes zoster virus, it is caused by the reactivation of which virus? Varicella zoster virus. That is also known as HHV type 3. So the same virus that causes the chicken pox, it is responsible for the herpes zoster virus. So the herpes zoster, commonly known as shingle, occur as result of reactivation of the varicella zoster virus. So when suppose a person was first infected with the varicella zoster virus, usually during the childhood, they develop chicken pox. After recovery from the chicken pox, the virus does not completely leave the body, but it become latent, that is, it become inactive in the nerve cells, specifically the dorsal root ganglion. So the virus will remain dormant in the nerve cells for many years after the primary infection. So during this latent phase, the immune system keeps the virus under the control. So as the person ages, or if their immune system become weakened due to the factors like stress, aging, illness, or certain medicines, the varicella zoster virus will reactivate. So once it gets reactivated, it will travel along the sensory nerves. So it travels from the nerve ganglion to the skin surface following specific nerve pathway that are known as dermatomes. So before the characteristic rash appear, the individual often experience a prodromal phase that is characterized by pain, itching, tingling, or burning sensation along the affected nerve path. So this is neuralgia. So within a few days of the prodromal symptoms, a rash develops around the affected dermatomes. So the rash, it consists of cluster of fluid filled vesicles on inflamed and reddened base. So this red is quite painful. And it is generally, the rash is generally confined to one side of the body. Before the characteristic rash appears, the individual often experience a prodromal phase that characterized by the burning, itching, tingling. So this is known as neuralgia or neuropathic pain. So within few days of prodromal symptoms, rash will develop. The rash will consist of cluster of fluid-filled vesicles on the reddened base. So the vesicles quickly progress through stages of development. there will be pustule formation and crusting. So the rash will take about 2 to 4 weeks to resolve. So in some cases, even after the rash has become totally cleared, the pain will persist. So this is known as post-herpetic neuralgia. So that occurs due to the nerve damage during the active infection. Other important terminology is what is zoster sign herpetic. Infrequently there is dermatomal pain without the development of the rash. So that is known as zoster sign herpetic. Upon healing of the lesion, scarring with hypopigmentation or hyperpigmentation, it can occur. Other is Ramsay-Hunt syndrome. Sometimes the chickenpox virus, it can reactivate in the nerve of the geniculate ganglion. So this might cause condition known as Ramsay-Hunt syndrome. So people with this syndrome will have skin sores in the ear canal and problems with the face and auditory nerves. The people might experience facial pulses, hearing loss, dizziness, and ear-related symptoms. Few patients may experience a pain after the rash is gone. So that is post-herpetic neuralgia. Sometimes a person has recovered from the rash caused by the herpes zoster in the face nerve area. They might develop a condition that is known as granulomatous meningitis. So that can lead to stroke. Because the virus and the inflammation can affect the blood vessels in the brain. So again, the treatment for the herpes zoster is as similar as that of primary herpes simplex virus. That antiviral regimen could be given, painkillers could be given, drugs like acyclovir, famciclovir can be given. So the next is the cytomegalovirus. The cytomegalovirus, it is the member of herpes family and cause various infection in the human. The cytomegalovirus is also known as HHV type 5. So remember, this virus, it can be found in various body fluids like saliva, blood, urine, tears, etc. So remember the cytomegalovirus. This cytomegalovirus, it is a type of herpes virus that contains a double-stranded DNA. And it is known for its distinctive spherical capsid. So the capsid, it is just a protein coat that will surround and protect the genetic material of the virus. Remember, its capsid, it is spheroidal in shape. So this cytomegalovirus, it is transmitted to various routes like including congenital, neonatal, sexual contact, blood transfusion and organ transplantation. So seroprevalence, it rates
it varies with the age. About 50% in individual age 6 to 49 years and over 90% in those with the above 80 years. Now how do this virus spreads? The virus can be present in the bodily fluids like saliva, blood, urine, tears, genital secretions and the breast milk. So it can spread through the organ transplant. The people who receive organ transplant are given medications to weaken their immune system so that their body do not reject the new organ. So this make them more susceptible to infections like cytomegalovirus. So if the donated organ will carry the virus, it can spread to the recipient. It can also transmit through the blood transfusion if the donated blood contains the virus. The third, it can transmit through the breast milk of the infected woman. Infected women can pass the virus to their unborn babies. Now the cytomegalovirus, they are often asymptomatic, but symptomatic cases occur with the immunosuppressed adults and those with the AIDS. So remember the biopsy sample that are taken from inside the mouth that shows the cytomegalovirus related lesions. In these samples you may find scattered infected cells that appear very swollen. So these cells, they will have inclusion bodies both inside the cell, that is in the nucleus, and its outer part, that is the cytoplasm. So because of their appearance, these enlarged cells are known as owl eye cells. So special staining methods like Crocot-Gomory and PAS stain can help to highlight these inclusions in the cell cytoplasm. Now what are the clinical features? The cytomegalovirus infections, they are asymptomatic. Congenital cytomegalovirus, it can lead to jaundice, hepatosplenomegaly, thrombocytopenia and CNS involvement. In the immunocompromised patient, such as transplant recipients and those like patient with the AIDS, they are high risk for the severe cytomegalovirus disease. So the symptoms, they can include from mild fever to multi-organ involvement, including the hepatitis, leukopenia, pneumonitis, gastroenteritis, etc. There could be chronic ulcerations caused by cytomegalovirus in the immunocompromised patient. These are the chronic ulcerations associated with the patient with the AIDS. Now, how can you diagnose this cytomegalovirus? We can diagnose the cytomegalovirus through the biopsy technique, through viral culture, and PCR. They are other method to detect the cytomegalovirus. In the blood, there may be increase in the atypical lymphocytes. So what are the treatment? The cytomegalovirus usually go after on its own. but the immunosuppressed patient may need treatment. The treatment of choice is canciclovir and antiviral drugs that could be given. Moving to next is the infectious mononucleosis. So infectious mononucleosis, it is caused by Epstein-Barr virus or human herpes virus type 4. So the virus, remember, it is transmitted through intimate contact like kissing or sharing utensils. So most infections in children are asymptomatic. However, symptomatic children may exhibit fever, lymphadenopathy, pharyngitis, hepatosplenomegaly, and the respiratory problems. Pneumonia is a frequent complication that could be seen. Apart from that, their complications can be splenic rupture, thrombocytopenia, autoimmune hemolytic anemia, aplastic anemia. Now very important is how will you make diagnosis of infectious mononucleosis. The diagnosis is through, remember for your MCQ exam, the diagnosis is through heterophile antibody test and IgM antibodies that cross-react. The heterophile antibodies, they are just the IgM antibodies that cross-react with the sheep and horse erythrocytes. So they are used for the detection of Epstein-Barr virus. Other test is the monosport assay or the Paul-Bunel test. They are the common methods for detecting heterophile antibodies. So real-time PCR, it can be used for the immunocompromised patient. The Epstein-Barr virus can be associated with various conditions like nasopharyngeal carcinoma, oral hairy leukoplakia in HIV patient and transmitted patient, Burkitt lymphoma, and nasopharyngeal carcinoma. So that is point important for your entrance exam point of view. The infectious mononucleosis typically resolves within 4 to 6 weeks. The symptomatic relief, NSAIDs can be given. They are the anti-inflammatory drugs that helps to alleviate the common symptoms. Adequate fluid intake and nutrition, they are necessary. The patient with significant spleen enlargement should avoid contact sports to prevent the rare risk of spleen rupture. Antibiotic avoidance, ampicillin, amoxicillin and other penicillin should be avoided as they can cause skin rash in patient with the infectious mononucleosis. Corticosteroids, some clinician may use the short-term corticosteroids. They are used to reduce the acute symptoms. Corticosteroids may be considered for the severe complications like airway obstructions, hemolytic anemia, thrombocytopenia. Antiviral drugs like acyclovir, valcyclovir, famiciclovir, they can be given. Moving to next comes the enterovirus. So they are the part of the picornavirus. Picornaviridae family. The most common is the herpangina. Herpangina, it is caused by various types of Coxsackie virus, A1 to A6, A8, A10. The hand, foot and mouth disease, it is caused by Coxsackie virus A16. And acute lymphonodular pharyngitis, it is associated with A10 Coxsackie virus. So most of cases these infections occur in summer or early fall. The crowded place and poor hygiene, it contributes to their spread. The main way these viruses they are spread is through the fecal-oral route. So regular hand washing is important during outbreaks. The incubation period is usually 4 to 7 days. The symptoms of herpangina include sore throat, difficult swelling and fever. The patient may experience cough, runny nose, loss of appetite, vomiting, diarrhea, muscle aches and headache. So usually a small number of lesions around the soft palate or the tonsillar pillar, they could be seen. The ulcerations are small. It takes time of 7 to 10 days for them to heal. The hand, foot and mouth disease, it is similar to herpangina, where skin and rashes and oral sores happen along with the flu-like symptoms. There could be sore throat, difficult swallowing and fever, cough, running nose, loss of appetite, vomiting, diarrhea. These are the associated symptoms. So the skin spots start as red patch, then become blister in the center and they heal without scabbing. The mouth sores are similar to herpangina, but they can be more and might appear more in the front of mouth. These sores are usually 2 to 7 mm wide, but they can become even bigger, turn into ulcer and heal within about a day. So for diagnosis herpangina, hand, foot, mouth disease, doctors usually look at the symptoms, how they appear. Lab test can be done to be sure. PCR technique are really good at finding the virus in the body. Most of time these infections go away on their own without causing any big problems. The next is the measles. Measles, it is also known as rubeola. So other name of measles, remember, the other name of measles is rubeola. That means the red spot. So it is a contagious viral infection that is caused by which virus? Measles virus. So it primarily affect the respiratory system and can lead to distinguished rash. So it is caused by RNA paramyxovirus. So what could be the transmission? The measles, it spreads through the respiratory droplets. So when an infected person coughs or sneezes, it can be transmitted by direct contact with the infected surfaces. So the infected materials are the secretion of nose, throat and respiratory tract of the individual. So what are the symptoms of measles? The symptoms. What are the symptoms of the measles? The measles typically begin with the fever. So remember the 3 C that is coryza, that is runny nose. Second, remember the 3C, coryza, cough, coryza, cough, and the conjunctivitis. So remember the 3C, coryza, runny nose, cough, and the conjunctivitis. Along with that, you will see the Koplik spots. These are the small white spots. So these are the Koplik spots that are present on the buccal mucosa. These are the small white spots with the red border that may appear inside the mouth. Typically, a few days after the initial symptom, a red rash appears on the face and spreads to the rest of body. So this rash would last about a week. So in eruptive phase, you will see a maculopapular rash behind the ears and spreads in a few hours over the face, neck, and extend throughout the body. The lesion and fever, it disappears in 3 to 4 days. So post measles stage, you will see weight loss, weakness, deterioration into chronic illness. It may cause growth retardation, diarrhea, or other infection. What are the complications that could be associated? The complication can be seen in a young individual and those with a weak immune system. The complication includes pneumonia, encephalitis, and rarely death. So remember, measles, it usually spreads in the late winter. It spreads in the late winter period. The virus can cause significant enlargement of the lymph tissues, including the lymph nodes, tonsils, adenoid, and Peyer's patches. So oral manifestation, remember the Koplik spots. These are the specific oral signs of measles, but other oral tissues like candidiasis, NUG can occur in malnourished children. So the prevention is vaccination. It is the key to prevent the measles. The measles vaccine, it is included in the MMR vaccine and it is highly effective. Now on histopath, you will see the initially you can see the Koplik spots. These are the area of the thickened epithelium and they show fluid filled spaces between them and abnormal cells maturation. Along with that, you will see a giant cells. Over time, these Koplik spots will mature, the epithelium undergo neutrophilic exocytosis that can lead to microabscess, epithelial necrosis, and ulceration. Along with that, you could see this is the Warthin Finkelday giant cells. The hyperplastic lymphoid tissue that contains numerous multinucleated giant lymphocytes are known as Warthin Finkelday giant cells. So initially they were thought to be specific for measles. Remember, for your exam point of view, similar cells they have been seen in Kimura disease and lupus erythematosus. The next is the rubella virus. It is also known as German measles. So it is a contagious viral infection that is caused by rubella virus.
So it is generally a mild illness but can have a serious consequence if contacted by the pregnant woman, as it can lead to congenital rubella syndrome in the unborn babies. So it belongs to Togaviridae family. So the incubation period is around 2 to 3 weeks. The incubation period is around 2 to 3 weeks. So many cases of rubella, the symptoms generally starts with low grade fever, a rash that appears on the face and spreads to the rest of body, swollen lymph nodes behind the ear, mild cold like symptoms like runny or stuffy nose could be seen. There may be tender lymph nodes, etc. The rash usually starts on the face and the neck region, and it spreads to the body within a day and fades with the desquamation. It is usually resolved by day 3. So orally you can see this is known as, orally you can see oral lesions that are seen on the face. They are known as for shimmer spots or for shimmer sign that is seen on the soft palate in case of rubella. The complication includes the arthritis, encephalitis, congenital rubella syndrome if pregnant women are infected. So what is the impact on the pregnancy? The congenital rubella syndrome, the greatest concern with rubella is its impact on the pregnant woman. If a pregnant woman contracts rubella in the first trimester, it can affect the developing fetus and cause loss of pregnancy or stillbirth or severe damage to the developing fetus, causing eye problems, hearing problems, and the heart damage. Now, how can you diagnose rubella? Rubella is usually mild and specific treatment is not required. Laboratory tests, they are necessary due to often mild or non-specific clinical presentation. The serological analysis, virus culture, PCR are used for diagnosis. The detection of IgM, the presence of specific IgM antibody indicates recent rubella infection. The persistence of IgG antibodies beyond 6 months or demonstration of IgM antibody, it is the diagnostic for congenital rubella infection. The rubella is generally mild and specific treatment is not required. Antipyretic drugs can be used for the sympathetic relief. The vaccination is crucial for prevention. MMR or MMRV are recommended for children and non-pregnant women of childbearing age. The contraindication for vaccine includes the pregnancy, immunodeficiency, allergy to vaccine components, and febrile illness. So complication, if a pregnant, it can lead to CRS syndrome or congenital rubella syndrome that can cause birth defect, deafness, heart defects, cataracts in the children. MMR vaccine that consists of measles, mumps and rubella is highly effective in preventing rubella. It is given in 2 doses The first dose is given at around 12 to 15 months. And the second dose is given at the age of 4 to 6 years. So mumps, it is an infection that is, the mumps is an infection that is covered, that is caused by virus in the family Paramyxoviridae. So this infection caused diffuse swelling of the exocrine gland. Although the salivary glands, they are the best known site of the involvement of the pancreas, choroid plexus, and mature ovaries and testes. The mumps, it is an infection that is caused by virus in the family Paramyxoviridae that causes diffuse swelling of the exocrine gland. The virus, it can be transmitted through the respiratory droplets, saliva, and the urine. So the disease is recognized by non-suppurative enlargement and tenderness of one or both the parotid gland. So other organs like pancreas, ovaries, testes, they are frequently affected. The incubation period is around 16 to 18 days with the range of about 2 to 4 weeks. In the temperature climates, mump usually occurs in winter and springs. So remember, the mumps is an invalid virus. So mumps, it is an enveloped virus with a single stranded RNA. So its viral envelope contains the spikes made up of glycoprotein that helps the virus attach to and enter the host cells. The transmission, the mumps, it is transmitted primarily through the respiratory droplets when an infected person coughs, sneezes, talks, or share utensils with the other. The virus can also be spread through the direct contact with the contaminated surface of object. So how the virus spread? The virus initially targets and infects the cells that lines the respiratory tract and the salivary glands, particularly the parotid gland. So once it enters the host, the virus starts to replicate and cause the characteristic swelling and inflammation of the salivary glands. So what are the features? Other symptoms include fever, headache, fatigue, muscle ache, etc. In some cases, the virus can cause complication like orchitis, that is the inflammation of testicles, encephalitis, and meningitis. That is inflammation of membrane surrounding the brain and the spinal cord. So mode of transmission: droplet infection or direct contact with the infected person. Incubation period may vary from 14 to 18 days. So the child usually complains of earache on the affected side prior to the onset of swelling. There may be pain, stiffness on opening the mouth. It involves the testes, pancreas, CNS, ovaries, and prostate. The swelling subsides over 1 to 2 weeks. So these are the complications associated. There could be orchitis, ovaritis, pancreatitis, meningoencephalitis, thyroiditis, neuritis, hepatitis, myocarditis, and the sensory neural deafness. So what could be the prevention? Live attenuated vaccines can be given. Single dose of intramuscularly. It produces detectable antibodies. So the MMR vaccine is safe and effective way to prevent the mumps. So the vaccination helps mumps outbreaks and reduces the severity of the disease if someone still gets infected after vaccination. So the best way to prevent mumps is by vaccination. So the next is the HIV virus. HIV stands for human immunodeficiency virus. It is a virus that attacks the immune system, which is the body defense against the disease. So the HIV, what it do is it gradually weakens the immune system by destroying a type of WBC that is known as CD4 cells or T cells. So that make it harder for the body to fight off infection and the diseases. The HIV, it is transmitted through contact with certain body fluids like blood, semen, vaginal fluids. It can be passed from mother to baby, sharing, injecting equipments, or use of contaminated blood transfusions and organ transplants. It can also spread from person who already have HIV. The most common way of transmission includes unprotected sexual contact, sharing the needles for drug use, and from mother to children during childbirth or during breastfeeding. So the HIV, during the early stage of HIV infection, that is also known as acute stage or seroconversion period, individual develop flu-like symptoms like fever, fatigue, swollen lymph node, sore throat, rash, and muscle ache. In the later stage of HIV infection, if left untreated, the virus can weaken the immune system and lead to acquired immunodeficiency syndrome. So during this stage, the individual becomes more susceptible to the opportunistic infections and certain type of cancers. So here the patient symptoms would be swollen lymph node, that are the one of the most earlier sign of HIV infection, diarrhea, weight loss, fever, cough, and shortness of breath. HIV latency refers to the period. It refers to the period during which the virus is present in body, but it is not actively replicating and causing syndrome. So during this phase, the virus resides within the certain immune cells, that is the CD4 T cells, but it is not producing new virus particles at high rate.
So let us discuss the oral manifestations of HIV. So first of all, there could be fungal lesions. Oral candidiasis is a fungal infection caused by candida yeast resulting in white patch on the tongue, inside of cheek and throat. Other fungal lesion could be histoplasmosis, Cryptococcus neoformans. The viral lesions could be herpes simplex virus, HS1 type 1 causing cold sore, HSV2 causing associated with genital herpes can lead to oral lesions in individual with HIV. Oral warts caused by human papilloma virus can develop in mouth and throat. Kaposi sarcoma. Kaposi sarcoma is a cancer often associated with HIV infection. It causes reddish or purplish lesion in the mouth. Cytomegalovirus. It can cause ulcers and painful sores in the oral cavity. HIV infections can lead to various bacterial oral manifestation. Example is the periodontal disease. Individual with HIV might experience more severe form of periodontal disease, including gingivitis, periodontitis, affecting the supporting structure of the teeth, that can result in red, swollen and bleeding gums. Nug and nup, they are the painful ulcers, can cause bad breath and tissue necrosis. People with HIV, they might be prone to bacterial infections that can lead to conditions like abscess and cellulitis. Tuberculosis. TB can affect the oral cavity, causing ulcers, granuloma and other lesions. Linear gingival erythema, that is characterized by red band along the gum line. Salivary gland infections. Bacterial infection can cause the salivary gland infections like the sialadenitis, inflammation of the salivary glands. Neoplastic oral manifestations, that could be Kaposi sarcoma. Kaposi sarcoma lesions can appear as raised, dark or discolored growth, non-Hodgkin lymphoma. Some types of non-Hodgkin lymphoma, they are more common in individuals with HIV. Squamous cell carcinoma, malignant salivary glands tumor. Other oral lesions associated with HIV disease may be oral ulceration, thrombocytopenic purpura, xerostomia, salivary gland disease. Coming to the diagnosis part, the diagnosis of HIV is important. That consists of antibody testing, confirmation of HIV testing is typically done through antibody testing. Enzyme immunoassay and rapid HIV antibody, they are commonly used. Other is the Western blot assay. So it is confirmed through Western blot assay. Seroconversion period. Seroconversion, the development of detectable antibodies, usually occur 3 to 12 weeks after the infection. Home testing kits are available, allowing the user to send a sample to the laboratory for testing. Antigen test like P24 test, antigen capture assay, can detect the viral antigen in the blood before the antibodies develop. AIDS is diagnosed when the laboratory evidence of HIV infection is combined with specific criteria such as CD4 T lymphocytes. They are below 200. per microliter. So the regular testing and monitoring of CD4 T lymphocytes counts and viral load, they are important for managing the HIV infection and assessing the effectiveness of treatment. The treatment of candidiasis, we can give is clotrimazole, nystatin, systemic agents, fluconazole, itraconazole could be given. Antiretroviral therapy could be given. Commonly used is these are used as a first line ART regimen in India.